Hello, my name is Rachel Blassingame. This is my family theory presentation on family health model that was developed by Sharon Denham. I hope you enjoy my presentation. In this presentation, I will be discussing what is the family health model, key concepts of this model, a description, how it is applied in nursing, two research projects that were guided by this model, and lastly, a summary and conclusion discussing highlights and takeaways. First, what is the family health model? The family health model is also referred to as FHM, is a model that was designed to provide a framework for nursing to better predict family health outcomes, while also gaining a better understanding from an ecological perspective on complex variables that can influence family health and illness outcomes. By using a more mindful approach to align nursing care with the family care needs. Furthermore, this helps guide the delivery of family-focused nursing care and how to approach each family when considering actual and potential environments. The environments that are included in this assessment can either be changed, tailored, or expanded. According to Kagan in our textbook for family healthcare nursing, dynamic family health routines are behavioral patterns that reflect self-care, safety and prevention, mental health behaviors, family care, illness care, and family caregiving. Key concepts of the FHM are: it coordinates processes, guides nursing assessment and interventions that would be beneficial for the family as a whole. It determines meanings of both external environments and healthcare routines for the family. There are three domains: contextual, functional, and structural. These three domains help to assess, identify areas of concern, plan, and implement nursing actions. Also, they suggest methods on how outcomes should be evaluated. The contextual domain is the family context. This is the first domain when conducting an assessment on a family. This domain explains experiences that deeply connect the family that is shared over a lifetime. The context includes internal factors such as individuals of the family unit, extended family members, genetics, culture, ethnicity of the family. External factors include friends, peers, coworkers, neighborhoods, community, and nation. A larger social context include history, policy, and time orientation. Availability of resources such as money, health insurance, and time can all affect health perception in the family. We have to keep in mind each family member experiences things differently, and they all have unique viewpoints. Although sometimes these can be predictable, members and families evolve over time, and this changes as the family grows. So this domain is fluid and changes over time. The second domain is the functional domain. In this model, it is used to explain the interactive processes as the family changes over time. This includes core processes such as communication with each other and outside of the household, roles and expectations of each of the family members, caregiving, and control. External influences that can include places of employment, school, churches, social, or public policy can all impact how a member responds to wellness or disease. Immediate events such as mental illness, disability, or tragic death are also included in this domain. Both family and peer groups impact resiliency, identity, adaptation, and accommodation. The third and final domain is the structural domain. In this domain, family health routines and habits, whether healthy or unhealthy, are assessed. This is further broken down into the meanings of the routines, types, characteristics, and purposes. Routines are patterns that develop over time. They are often recognized. An example of this is knowing that your spouse would have for breakfast. Also, they are often shared, such as a family having dinner together every evening. Although these routines are dynamic, they seem to be stable as time passes. Creating healthy habits can impact wellness and disease for the whole family. An example is nutrition. This has a huge impact on health, either a negative or positive impact. Eating a diet high in sugar and fats increases the risk for disease. Denham, in a seminar she held in 2003, recommends setting measurable and obtainable goals. This allows outcomes to be evaluated easier and determine if the plan needs to be modified. Key components. It correlates multiple factors that influence family health and illness. It considers multifaceted traits, interactive processes inside and outside the family unit, experiences in life that can also impact health perception of the family. An example of this is how the health and well-being of a family can be affected when a member is diagnosed with a chronic illness. Member connections to each other and those outside of the boundaries of the household that have importance can be identified. FHM definitions include both health and illness are thought to be influenced by the family context. Family is defined as individuals that live together as a group who have unique viewpoints and experiences that support one another. Health is defined as an adaptive state experienced by family members as they seek to optimize their well-being and wrestle with liabilities found within self, family, households, and at various environments where they interact throughout the life course. Environment includes internal and external factors that influence health and illness. Many dimensions are included: biophysical, psychological, emotional, social, spiritual, and vocational. Achieved by accomplishing family goals such as reducing risks, preventing illness, health maintenance, and self-actualization. Nursing is defined as family focused in this model. How is this used in nursing practice? You may be asking yourself, how can I implement this in my practice? Application of the family health model. The focus is shifted from acute episodic clinical care to the more mindful approach about relationships between the individuals within the family unit. All factors are not addressed with each patient. It is used in conjunction with the patient's presenting clinical problem. It will be unique depending on the family's needs. Questions to consider with each patient. What is the most important issue at this time that I need to address? Do other factors need to be considered? What features of the family are relevant to this situation? These questions address assessment areas that may require intervention by the nurse. Is there evidence that supports this theory? How do I know that it's effective? The first research project that I'll discuss was guided by the family health model, was a case study aimed on exploring the meaning of place for well-being of the family that is living with chronic illness. The reason this was chosen is that living with chronic illness is a family affair, and the meaning of place and the relation of family well-being that live with chronic illness are rarely described. A qualitative design was chosen for this case study. Data was combined from a photo voice and family research interviews with 10 families that live with chronic illness. The researchers concluded that the meaning of place for families living with chronic illness is described as a shared respite. Other sub-themes included a place of relief, a place of reflection, and a place of recreation. On the second case study, the aim was to determine if involving family and self-care interventions resulted in a positive outcome for patients with diabetes. A quantitative design was used. Articles from 1994 to 2014 were reviewed and assessed on the impacts on patient outcomes and the extent of the family involvement. 26 cases were chosen that described family-based diabetes interventions for adult patients. The results revealed that families can have either a positive or negative impact on diabetes self-care interventions. An example is lifestyle modifications often conflict with other established family routines. Family members typically are involved in grocery shopping and cooking meals. This can help or hinder the process of modifying the diet of the patient. However, chronic disease affects everyone in the family. As healthcare providers, we can influence the family to make healthy changes by providing education on diabetes. It can be beneficial to not just the member with diabetes, but the family as a whole. To summarize and conclude this presentation, the family health model is used to correlate chronic illness and family structures. By using a different approach and considering multiple factors such as interactive processes, life experiences, internal and external variables, this will help guide family-focused nursing that explains and predicts possible outcomes for that family. We discussed the 3 domains that are considered when doing a family assessment: contextual, functional, and structural. However, not all factors are addressed in every situation. It is designed to be tailored to the individual and family's needs. Using motivational interviewing to elicit change can be beneficial for the family as a whole. How this will be applied for my family assessment assignment. This theory will be applied to my family assessment assignment by using the ecological factors and determining potential outcomes for the family that lives with chronic illness. This will help clarify nursing interventions that should be implemented to improve the health and well-being of the family as a whole.